This is David Schwab, and welcome to iADS. This is the Member Spotlight. Today, our guest is Dr. Dan Diaz. Dr. Diaz, welcome to the program.
Thank you very much for having me. Really appreciate it and excited.
So, just tell us a little bit about you. What's your background in professional training and sort of how you got to where you are today?
I'm an alumnus from NYU College of Dentistry. I graduated in the year 2015. After that, I went on to do a GPR program at Jamaica Hospital in Queens. I then went on to do a non-categorical fellowship year at Harlem Hospital in oral surgery, and then matriculated into the program as a categorical resident the following year and have been there since. So I'm currently in my third year at Harlem Hospital in the oral surgery program.
Okay. So what is your anticipated completion date of the program?
My anticipated completion date can't come soon enough, but it's going to be June 30th of 2021.
Okay. And are you planning to practice in the New York area?
At this point in time, I believe so. I have a lot of family and ties and relationships that I've built at this point in time that are probably going to keep me in the at least Northeast area. So more than likely, I see myself in New York. Yes.
There's so much talk today about the professions changing and oral surgery is changing. You're the perfect person to ask because you're right in the thick of it in the residency program. So where do you see the profession going, and where do you see oral surgery going in the next few years?
So at this point in time, I think that there's a lot of uncertainty surrounding not only just oral surgery, but dentistry in general. I think that given the times, a lot of people are actually searching for answers in order to kind of determine where their practice is going to be headed and where they see things moving. I wish I'd be able to give a better answer at this point in time, but it's just the state of where we are currently.
Well, no one has a crystal ball, and you're right. We've got this COVID-19 overlay. And you said, gee, a couple of months ago, you might have given a different answer. So let's just turn back the clock. Where were things going until all this came up, would you say?
So the way I see it is, at least at our program, personally, there is a lot of interdisciplinary conversations. We're lucky enough to have craniomaxillofacial specialists at the program. We have orthodontists, pediatric dentists, as well as general dentists. And that's the way I truly see the profession continuing to move. I think that in the past, maybe there were or the dental field might have been a little more exclusive in terms of specialists staying off to themselves, general dentists staying off to themselves, but truly more of an interdisciplinary approach is something that I see becoming a little more common moving forward in the future.
The interdisciplinary approach, of course, is something that iADS stresses and talks about. And I know you're active in iADS, and one of the goals of the organization is to reach out to people just like you, people who are in residency programs and who are, really on the leading edge of oral surgery in terms of education and just starting a career. So tell us a little bit about how you got involved in iADS and how you might see it valuable to you.
Yeah, so I was actually approached by Dr. Scott Peters, a pathologist, at one of our meetings that we were having a few months ago. And Scott had let me know about this great organization that he was part of. He kind of gave me an overview of what iADS was all about. Luckily enough, I happened to know Dr. Robert Horowitz as well, and I was able to really get a lot of background from Dr. Peters at that point in time. He passed my information along to Dr. Farber, and I was able to speak with Dr. Farber and really had a nice relationship with Dr. Farber almost immediately from the time that I was able to speak with him on the phone, and just our interactions thereafter have really been positive. He's really been able to shed a lot of light on what it was that iADS was in the past and what his vision is in the future. And I think that is something that's very promising and something I definitely want to be a part of moving forward.
I think it's great that you're involved, but maybe you could just shed a little light on, even in this early stage. First impressions are really important. What are you getting out of iADS? How are you accessing it? What's been your early experience?
So my experience with it at this point has really just been one more so of an observer, really getting to learn the website, learn the ins and outs, see what other members have been using the website and the community for in the past, and now seeing how it'd be beneficial for not only myself as a resident, but once I'm a practicing doctor, what that would look like for me. So I think that what's great about this community is, from a resident standpoint, excuse me, is that we really don't have so much experience from the business aspect of it. This group isn't necessarily that it's business oriented, but it's comforted in knowing that there are people that have been out in practice for many, many years that have much more experience than us, not only from a dental standpoint, but from that business standpoint where we don't necessarily have so much experience. And hopefully any questions that we have, we'd be able to voice in any of the forums that iADS has. Again, that would be from the business standpoint, but even from a newly graduated resident that is out in practice, there's still, I'm sure, hundreds and hundreds of questions that we're going to have. And it's nice to have a specialist community where it may not necessarily just be an oral surgeon that can help you out, but a periodontist, an endodontist, anyone that might be able to shed some light on what it is that you have a question on.
Well, you're correct. It's a great community. And I think your input and your perspective, considering where you are in your career, is absolutely vital to all the other folks. So everyone mentors everyone else. Everyone's a teacher and everyone's a student. And I think it's a great community that will help everyone. Well, Dr. Diaz, we wish you all the best. And we want you to feel that you can come back and access iADS and ask any questions you want and contribute all you want. And talking to us today on this interview is actually a form of contribution because it helps give people insight into who you are and what you do. So thanks very much for joining us today.
Well, thank you so much for having me. I genuinely look forward to all of my interactions with everyone on iADS moving forward, and truly hope that the community continues to grow so that this way, not only myself, but dentists in the future have somewhere to go and really know that they have a safe haven almost to seek out any questions and answers that they may have or need.
This is David Schwab. This has been another edition of Member Spotlight.